I love the way they're showing the viral particles. They're just spreading out everywhere. That absolutely does happen. That's why it's really important to dab when you cough to try and limit that spread. We've seen it actually spray 6 feet away from you when you cough or sneeze. And germs have hang time. So you can walk into an empty room that someone just sneezed in and be exposed to those germs. I don't know why I did that.
There you go.
This is such a good example of how germs spread. Droplets, meaning someone coughs or sneezes or speaks. Contact, meaning they coughed on their hands and they touch something, they give it to somebody else. When we talk about disinfecting your hands, wearing a mask, we're talking about decreasing droplet spread and contact spread.
Have you seen my ID badge?
No.
I had it last night, but maybe it fell out of my bag.
I lose my ID badge all the time. Like, not permanently lose it, but have it in my car, in my trunk, in my suitcase, in my home. Sometimes Bear steals it. Sorry, Bear.
Your temperature's almost 101. Your other symptoms?
First it was a sore throat, then my body started aching. And then there's this cough. I even had my flu shot.
Unfortunately, influenza is constantly mutating. The shot always lags behind.
Both very accurate statements. In fact, during this time frame in February, I was working in my primary care office. We knew COVID was around, but we didn't think it was everywhere yet. So a lot of patients were coming to my practice with upper respiratory viral symptoms just like this: fever, cough, muscle aches, and we thought they potentially had influenza. We gave them antivirals for influenza. The reality is, even if you had your flu shot, you can still get the flu, but your case should be milder.
My daughter's very worried that I might have this virus from China. What's it called?
Have you been to China or been around anyone who's been to China recently?
Those are the questions we were asking. At that time, I think we were referring it to nCoV-19, right? Was it nCoV-19?
The virus has damaged your mother's lungs. Her body is working harder and harder to breathe, but her blood oxygen levels continue to drop.
She definitely has corona.
We're doing everything we can to help her.
See, that patient was actually in a negative pressure air room. They were isolated from other people because at that point, we were deciding whether COVID-19 was only needed to maintain a droplet precaution where you just cover your face and the patient's face with a mask, or do we need a negative pressure room because COVID was spread through airborne transmission, where the virus just lived in aerosolized particles in the air all the time. And what we came to realize is it's more of a droplet spread, but there are some instances where it can be spread through aerosolized particles, especially during medical procedures like intubations.
You have COVID.
Okay, now what?
Now you go home.
That's it?
That's it. There's no treatment. Stay away from people. Come back if you have trouble breathing. Goodbye.
I forget because I don't watch this show regularly how funny Sean is. COVID-19 is a viral illness. So if your oxygen levels are not dropping drastically and you just kind of feel lousy and you have a mild fever, your body is the one that has to fight this off. Like, there's very little that we can actually do in the hospital systems. And by keeping you in the hospital, we're actually increasing the risk to healthcare providers and other patients.
25 tests per day? No, just give me one of tomorrow's. Hello? County Health Department, I don't have time for them, and apparently they don't have time for me.
I remember in March, I had a patient who I suspected to have COVID-19, but I didn't have a test available. So I was calling the Department of Health, trying to secure a test for them, eventually getting them a test, finding out that they were in fact positive. Luckily, everyone was wearing a mask at that point, so we decreased the spread, we cleaned the room, sent them out the back door, tried to do our best to limit the spread of this virus. There's just a lot of things we didn't know in the beginning that we know now.
If I'm sick, is my baby sick?
This disease doesn't really seem to affect children or babies like it does adults. Should we admit her?
She's probably safer at home.
Once at home, do you have a support system? Can anyone come help you?
Good question.
In case you get worse?
It's just me and the little one.
Good doctors always ask questions like this. If I'm sending a patient home that I'm sort of questionable on, and let's say they had a concussion, I always want to make sure that there's someone to keep an eye on them, that if they become unconscious, they have someone to call for help and to check on them.
If I come home, do you want me living with you?
Of course, that's the point.
Every night after 12 hours of COVID patients to hang out with you and Kellen And his asthma.
Interestingly enough, we've seen conflicting reports on how COVID-19 affects those with asthma. Now, if it's just asthma alone, it doesn't seem to be as bad as we expected it to be. But those who are asthmatic and have other comorbidities like heart disease, obesity, those are the patients that seem to be experiencing worse symptoms and worse outcomes.
We do everything we can. We hammer at official channels and every manufacturer's rep that we deal with and see what companies, if any, have undisturbed...
Nuts or no nuts?
I'm sorry, I'm in the middle of a meeting with the board.
Hey, everyone. I'm just making banana bread.
One of the most searched terms in the height of this pandemic was how to make sourdough bread. Go figure. I've never made sourdough bread. I've never Googled it. I don't know who's sitting at home Googling it, but apparently sourdough bread was the thing everyone was making, not banana bread.
Your husband's blood oxygen level is dangerously low.
That can't be.
So one of the hallmark symptoms of COVID-19 is decreased oxygen saturation in your blood, where you're actually not getting enough oxygen from usually the edema or the scarring that's happening in your lungs as a result of the inflammation that occurs with this virus. One of the dangerous parts of COVID-19 is not only are you infected with this virus that you're fighting off, but some people have an overreaction or a cytokine storm where all these inflammatory cells come to the lungs and actually cause a bigger problem where you can't get enough oxygen going and being delivered to the rest of your body, your vital organs, your liver, your kidneys, your brain, and so forth. Our solution to that was to ventilate, meaning intubate all these patients. And as we did that more and more often without treating them with proper medications like we have now and we know which ones work, patients actually got worse on ventilators because we were over-ventilating people. And it's not because we're stupid or we were intentionally harming people, but it was simply because it's a novel virus and we did not have guidelines on how to best treat patients with it. We were learning about it on the go.
You have a surplus of EKG leads?
No, we've got a shortage, but that's a problem that can wait.
The PPE situation was really dire in the beginning of this pandemic because China was hit first and a lot of our manufacturing facilities are in China. And because of that, they actually redirected all of their shipments to their country because they needed them. And as a result, we were facing a lot of shortages for gloves, for EKG leads, for swabs, for test kits, antibacterial wipes, the vials for injections, the wiring and the tubing for ventilators. There was so many shortages that were happening simultaneously. It was a truly dire situation, especially here in the New York City area. Him rubbing his ears like that is from the mask. Oh my God, in the beginning, just wearing the mask for countless hours, my ears hurt so much. I just remember being so sore. But as we learned to use those little headpieces in the back where you could actually have the mask stay on there as opposed to on your ears, it made the world of a difference. And for those of you who haven't ever worn an N95 mask, they're uncomfortable because they offer more protection. They're more form-fitting, you have to get them fit tested, but they also put a lot of pressure on your face. They leave marks. That's why all those pictures were making the rounds of nurses, doctors who were having bruising in that area from just wearing them day in and day out. And a lot of times they were reusing equipment that was meant to be disposable.
You work in a hospital?
Yes.
Could you wait for the next elevator? I appreciate you.
You know, it's funny, in New York, if you ever wore your scrubs out during that period, everyone wanted to say thank you and was quite grateful, and that's amazing. But at the same time, everyone wanted to keep their distance, rightfully so. I understand you don't want to put yourself or your family members at risk, but it didn't feel good that you were being alienated like that. So it's part of the process.
My mother is in there, all alone, hooked up to a machine. I just need to see her and tell her that I love her.
There's a human toll that it takes on family members, not being able to see your family member, and if you're the one ill, not seeing your family members. I will also venture to say, and I don't have evidence for this, but I will say that hospital errors do go up if you do not have family members present and advocating on your behalf, especially if you're unconscious. Now, what we've learned from that is we're trying to keep families more updated, trying to keep them involved if they're not there at the bedside through virtual care, giving them scheduled regular phone calls, because we realize that when we're in better communication with the family, we actually get better outcomes for our patients.
Pushing epi.
Why is no one doing chest compressions? I don't understand. Do some chest compressions.
Clear.
Do some chest compressions.
VFib now.
Did you see those horrible chest compressions? She just put her hands on the chest, didn't even compress.
200 joules. Clear.
Okay, I don't know what. These people have high-end experts on set. You start chest compressions and then you use a defibrillation. You know, I have heard in the beginning of the pandemic, because I wasn't in the hospitals, I was seeing patients outpatient, that they were decreasing the amount of chest compressions being done because they were worried about aerosolizing the virus. I actually just looked this up from the Red Cross. Performing chest compressions while wearing proper medical protective equipment, N95 respirators, or like how they have the whole bodysuit on, still means you should do chest compressions. Like do them. I don't know why they weren't doing them. I was trying to make excuses for them. They should have been doing chest compressions from the start.
Any cough?
Any fever?
No.
Any shortness of breath?
Sore throat, loss of smell?
No, none of that. Just searing abdominal pain and the runs. I'm pretty sure it's my diverticulitis acting up. My roommate is deeply into pandemic baking. I've avoided coming in. I don't want to catch COVID.
So one of the biggest problems we faced during this pandemic was patients not coming into the hospitals. And in the beginning, when we were really overwhelmed, that made a lot of sense. But as we became safer for patients to come in, we had different policies in place in order to decrease spread. Our testing improved, our capacity improved, our PPE improved. We wanted patients to come back because a lot of times when patients delay care, their diseases and conditions get more advanced and as a result become more difficult to treat. Patients who were having some signs of heart attacks were coming in much later, and as a result, some of our mainstays treatments weren't working as well, and the recoveries took longer. One of my main messages over the last 2-3 months has been to encourage patients to call their primary care offices, to call hospitals, to come in for the symptoms that are bothering them, and not wait.
It's pink, active, I'm breathing great.
In the midst of our research with COVID-19, we actually found that there was limited spread from mother to fetus of COVID-19, meaning that the mother could be testing positive for COVID-19, the baby was usually safe. Now, it doesn't mean there was no spread. There were some case reports of it happening, but for the large majority, we did not want mothers to panic because it wasn't happening. And children in general seem to fare better with this virus anyway. The numbers of children below the age of 10 dying with COVID-19 were spectacularly low. That doesn't mean it's completely benign for them because they could also spread this virus and be vectors, but it is reassuring for mothers, especially with the levels of anxiety that they are facing for themselves. Please don't put your masks on the floor and then put them back on your face. Sean, you're a doctor, buddy. Don't put it on the floor. I talked about germs having hang time, about them hanging out in the air. But folks, after they hang out in the air for those minutes or hours, where do they go? Right on the floor. Especially if you've been walking around a hospital setting and then you come home with your shoes on. Guess what's on that mask? Man, couldn't they just have me on set for one of these things? Could have helped me make it so much more. It'll be great, mate. Fill your cup day at 7-Eleven. Oh, that's so gross. This is what patients who have a male genitalia use to urinate in when they're in the hospital. If you're gonna be using those to fill your cup up on 7-Eleven day, make sure that those are fresh, because otherwise, ammonia? Me, my back hurts. I wonder why. My sleeping position. First of all, I don't know who this golfer is, but oh my God, what is he doing? That could be the most awkward. I feel like this is Photoshopped. This can't be normal. But yeah, a lot of times my patients wake up with pain that they didn't have the day before. A lot of times it's because they're sleeping on too soft of a mattress, too firm of a mattress, the wrong amount of pillows. There's a lot of things that play a role in how you feel when you wake up in the mornings. When I tell my therapist about my childhood, that's a lot of damage. I'm only laughing because of this gentleman's expression here, but yeah. In order to comply with privacy regulations, we are not allowed to call our patients by name. Will the lady with the itchy vagina please go? I don't even know what joke to make about that because it's just so funny on its own. I'm just gonna leave it out there for you. Think about it, laugh about it, together. Wait, what are you doing? The virus database has updated. Not that far from reality. When we give a child a vaccine, we're allowing the child's own immune system to better prepare for when that virus comes to attack them in real life. That's what the whole point of giving a vaccine is. And I'm not gonna lie, I've had babies look at me like this when I gave immunizations. I mean, their eyes don't light up, but they look at me like they're offended, like I disrespected them. I grew up in Brooklyn. I know what disrespect eyes look like. My question is, why do 1 and 2-year-olds know about that? It's like, why'd you use such a big gauge needle? And I'm like, yo, chill, B. I say B because it's a baby. A spider just tried to crawl across my hand, and now I'm Googling how to extract a fork from bone without causing more damage. R.I.P. my Audi TTS. I think it was a 2010. It was such a nice car. I was driving my beautiful, brand new, red Audi TTS, and a spider falls upon my cup holder. Scares me. I smush it. I crash my car. I don't want to tell you the whole story because it's even more embarrassing than that, but I'm going to be telling this Audi story in one of my upcoming videos. Did you know left-handed people have a higher chance of finishing their exam on time than people who died from not being vaccinated? You want to know a fun fact about left-handed people? They suffer more workplace injuries because most tools are designed for right-handed people. Bet you didn't know that one. When you're an adult and now you have to go to the doctor alone. Oh, Squidward. Actually, I recommend to my patients always bringing a loved one because when you're hearing news, bad news, good news, whatever it is, and there's details involved, sometimes it's easy to forget those details if you don't write them down especially. But if you have a second person there with you, not only can they also ask questions, which you probably have similar questions and you forget to ask, but they'll also be able to recount some of those details with you when you guys go home later. SpongeBob, my immune system the first time I get a virus. My immune system the second time I get the same virus. See? SpongeBob got diesel because your body builds up antibodies. It's like, look, we've seen this once before. We already know how to fight it. Let loose the warriors, AKA Diesel SpongeBob, and we get better. I just think you misunderstand me and my shirt buttons. I think my shirts fit me just fine. They're made for my body. A lot of people will jump to the assumption that they're very fancy. They're not. They're actually very reasonably priced, around 40, 50 bucks. When I sit cross-legged, that puts like an awkward hump into my back / lower pelvis area that puts a lot of strain on the lower buttons. So yes, they do sweat. They definitely earn their money. What would buttons want to earn? Not money. String? Whatever, they earn. They're stressed out, but they're earning. Tobacco industry, you want a nicotine addiction and lung cancer? Teens, no, WTF. Tobacco industry, it's mango flavored though. Teens, oh! I cannot believe how our society is slowly being addicted to the thing that we've spent decades on addicting them from. I know that makes no sense, but let me throw some statistics at you. In 2000, the smoking rate for teenagers was about 20%. In 2017, it dropped to 5%. That's a huge decrease. But guess what? Now it's being replaced by teens vaping. 30% of high school teens admit that they vape at some point. That's crazy. That's nicotine. It affects your frontal cortex, the decision-making part of your brain. You're now allowing it to learn the habit of addiction to a substance that's not healthy for you, like nicotine, in addition to all the other harmful chemicals that we find in these vape pens. And I know people want to jump in and say risk reduction is better than smoking. Well, if teens weren't smoking before and now we're giving them vape pens and they're vaping like crazy, that's not risk reduction anymore. Maybe we could talk about risk reduction for adults, but the problem here isn't teens. We got to talk about teens. Did I get too angry on that? Chest compressions are useless and it's better to wait for medical professionals to help. I'm about to get very unhappy. You're about to get very unhealthy. Chest compressions, chest compressions, chest compressions. They save lives, baby boo. And you best believe that merch is incoming. That contract is about to be signed. I'm about to have all that. DM, sorry, not here. DM. Chest compressions, yeah. The only essential oil I trust is WD-40. That is essential, and it is an oil. God, I hope it's an oil. I know it's a lubricant. I'm not even certain that it's an oil. Friend, what did your wife do just before she had the baby? Me, she went and then a bit of poo came out. Friend, I meant work-wise. Oh, bookkeeping. I've delivered babies. I think during my residency, I was up to like 30-something deliveries. Pooping is normal. It's part of the process. Don't panic. We wipe it away, we move on, we forget about it. There's a lot of pushing that happens. There's a lot of pain that happens. But the most important thing is making sure mama's healthy and the baby comes out well. Everything else, just a little poop that you can get wiped off. When the doctor's office forgets to ask for your copay. Wait, is this guy from an infomercial and I don't know? Because he looks kind of rad. I like his sweater. I think his sweater says CCCP, which in Russian means USSR. I think. Not quite sure. What's interesting to me is I see people go into the vet and they're like, okay, it's like $1,000 to give your dog an IV, anything for my dog. Here's $1,000 cash, no problem. I'm gonna go bankrupt, no worries, but fix Fido. And then they need to go in to see me for a physical and they need to pay $15. It's a whole big argument. Why do I need to pay $15? I don't understand. This $15 is ridiculous. It's $15 and we're gonna be preventing a lot of problems down the line that are gonna cost a lot more than $15. Think of that $15 as an investment in your health and your wallet. Your baby is sick as he definitely needs a shot. Cheers. Sick as Why does the doctor have no arms? Why do we have an armless doctor and then suddenly develops an arm to take a shot? That's my biggest concern in this whole thing. Me, spent 8 hours per day on the internet, eyesight gets worse. Me. My vision has gotten worse. And when I went to see my ophthalmologist, the thing that he told me is I've been staring at screens and textbooks for too long. Probably not textbooks because I did everything on the computer, but he says when you're close to the screen, your eye muscle strains so much it actually makes your vision worse over time. So he recommended that when I look at screens, I keep them further away from me. That will help my eye muscles relax some. I've been doing it. Haven't seen much of a result, but I feel like I'm on my way to contacts or maybe LASIK. That could be my future too. Would you guys want to see me get surgery on my eyes? Childhood injuries, fell off my bike, fell out of a tree, twisted my ankle. Adult injuries, slept wrong, sat down too long, sneezed too hard. Well, it's funny because childhood injuries, mainly acute problems. As you get older, chronic problems. You've been alive for many years. And if you do repetitive activities, sometimes it can wear you down, especially if you do unhealthy repetitive activities, like sitting. Sitting is generally unhealthy when you do it for 13, 14 hours of the day, which many of us do. Doc, so are you saying I should touch myself whenever I feel like it? No, Jeff, I said you could have a stroke at any time. I don't get the joke. Doc, are you saying I should touch myself whenever I feel like it? No, Jeff, I said you can have a stroke at any time. It reminds me of, that's in me. A stroke, not that kind of stroke. Talking about a stroke. Like a paddle stroke, but the other stroke. If you didn't get it by now, you're not gonna get it, so just move on to the next meme. I know you don't have a choice because I control the length of the video, but either way, just wait until for me to finish this monologue and then the next meme will start and then we could continue on with the joke, okay? I'll see you on the next meme. 90-year-old vaccinated person dies, anti-vaxxers. It's those damn vaccines. Anti-vaxxers, what are you doing? Just, for what? ¿Por qué? Porque eso necesito. No necesito. Por favor. Toma su vacunas. If you haven't seen, I've recently got into a fight. Oh no, oh no.
Video shows the right.
Oh my God. This is why I don't go on community rides. Like, no way. There, the biggest thing, obviously, head injuries, because you're hitting your head back, whiplash injuries, but also compression fractures of the vertebrae that line the spine. That's very painful and dangerous because it could lead to compression of nerves, which can create long-lasting symptoms or even lead to paralysis.
The ride fell about 50 feet.
Wow.
Carnival organizers are blaming the accident on a technical issue.
Well, what is the other issue? What is this? Is this like a... Did he let go? What happened?
State inspectors say the leg straps were not buckled and this was simply operator error.
The fact that that child survived that head injury down to the ground is a miracle. I can't tell you, when I saw that, I felt beads of sweat start to pile up on my scalp because I thought that was it. Child suffered broken bones, collapsed lung, and a brain injury. Yeah, blessed. That's all it was based on the concrete fall. How is there no padding on the ground? You gotta put padding.
Terrifying moments on opening day of this water park in California.
Oh my God, water parks freak me out. And there's all sorts of physical injuries that can happen. But with water parks, you gotta know it's a brewing ground for contamination, for bacteria and stuff. Swimmer's ear, otitis externa. You can get all sorts of infectious stuff. Legionella, E. coli, Shigella, norovirus, Giardia. There's so many bugs that could potentially be in water parks. Now, if they're properly sanitized and all the rules are perfectly followed to the T, there's much less risk, but you still gotta be careful.
Watch as this 10-year-old boy plunges down this slide before he tumbles off onto the concrete.
That's a lot of lacerations. Why don't they make them a little bit more padded?
Three-story slide called the Emerald Plunge is part of the Bay Area's brand new $43 million water park called The Wave. The attraction featuring 2 tracks with 80-degree drops.
80 degrees, that's straight down minus 10 degrees.
Here you see the boy shooting down the green slide, and as he gets near the bottom, he flies up.
What did he do wrong? He's even holding the proper position.
Over the edge and rolls onto the ground.
And that hyperextension of his spine, it could really compress those nerves that come out on either end.
The child suffered some bad scrapes and was briefly treated at a nearby hospital before being released.
What a lucky, lucky child. I want to know what went wrong, though. They're opening a new thing. They must have tested it, no?
8-year-old Evie Evans says she was riding Twisted Colossus at Six Flags Magic Mountain in California.
I already don't like the name. There is nothing magical about this mountain. It scares my poor little sensitive heart.
When she was hit in the face by a cell phone that was dropped by another passenger on the ride.
Wow, but I mean, can you blame the ride for that? You have to blame the other passenger. That's terrible. And by the way, phones, I don't know if you've ever been laying upside down and looking at your phone and then lose the grip and it hits you right in the cheekbone. It can literally cut you. Hard surface, hard bony surface, skin in between, cut.
Evie needed stitches to close a gash on her forehead.
Lucky it didn't hit her in the eye. You could lose your vision like that. Is this Splash Mountain? Oh, this looks like a bad idea. This is terrible. This is literally a concussion waiting and drowning waiting to happen. Why? Is this an accident or is this meant to happen? Oh man, ziplines scare me.
Ay, qué lindo. No, pues Valentina también se fuera parado. No, Valentina sí es de la primera.
Oh my God, my heart just sank. Minor injuries?
Ay, qué lindo.
It looked like the rope broke. How did, man, children survive the wildest accidents. See, there's like a fine line between managing risk, like when kids go on a playground and fall and get scrapes, like some of that is not a bad thing because you need to learn from how far you could push your body and how far you can take risks and managing those risks. It's all part of the development of the brain that's important. But then like, do you really need to go in the middle of a mountain ziplining? Like, I just wouldn't do it. Like I've done it before and I've regretted doing it the whole time.
But it did happen to Claire Clark. She was taking a trip down the corkscrew, a towering covered slide that twists and turns before touching down in the splash pool. Clark says to help get a start, she grabbed the top of the slide as she pushed herself in.
And my ring that I was wearing caught on something. I don't know if it was, I guess it was on the slide, I'm not sure. And it took my finger away with it. It looked like there was bone there, and that was it.
She says she knew right away.
And they couldn't reattach it?
Doctors were forced to amputate what remained of her finger.
It's really hard to reattach fingers, but it can be done because there's a lot of small blood vessels, nerves, joints, tendons. So even if they could reattach it, would it be functional?
I mean, you looked at the thing, and it looked like it was something out of like a Bugs Bunny or a Roadrunner cartoon where they just made a loop and said, yeah, there's our ride.
Some lunatic clearly just was like, build me a slide that's like that. And then they didn't consult anybody who had a background in engineering.
What? You should not do that. This is like worse than Jackass.
And it just takes you. All of a sudden, you're going really, really fast. The loop was fun, and yes, it hurt. Going through the loop and having your nuts get smashed on a fiberglass tube.
You think it's fun to get your nuts smashed on a fiberglass tube? That is not my idea of fun.
So they sent a couple other people down, and when those people came down, they came down with lacerations. They couldn't figure out why these people had lacerations from a giant loop. Then they took the loop apart and they found teeth stuck in the padding from the first couple people
This is like a full-on horror story. Teeth inside of a water slide? Where are the parents of these children? How are they allowed to sign consents for forms like this?
It's supposed to be scary, but not this scary.
Oh my
Watch
God.
Dallas resident David Salmon use his arm to try to steer himself down a slide near Austin, Texas.
Oh, did he dislocate his arm?
It's even normal speed.
Everyone's reaction when they're filming is the same. Phone down.
David posted on his Facebook page, "Too dang old to be going down water slides. Fell off this one that is over a rocky cliff. Broke my arm and fractured ribs. Multiple lacerations."
Again, lucky.
In 2017, a brave man plummeted to the ground while trying to rescue children trapped in a gondola. 25-year-old Albert Irvin climbed the Ferris wheel to save them.
They need a firefighter.
But as he freed the gondola...
He actually fell pretty decently. I'm sure he injured his arm, maybe his elbow, definitely broken there, maybe even a rib, but otherwise, not the most dangerous of falls.
And incredibly, he survived with just a broken finger.
Wow, amazing.
In 2016, 11-year-old Lulu's scalp was ripped off in a carnival accident. That's Lulu in sunglasses. She was happily riding on the King's Crown with her friends in Omaha, Nebraska. Then her long red hair got caught in the mechanism.
How does any human, after watching this video, still want to go to a theme park and ride rides?
Lulu's scalp and forehead were repaired using skin grafts.
That's so scary. That's why they say no loose clothing, but goes to show how strong hair is. It'll take the skin right off with it.
A day at the amusement park turned terrifying
when it
a
gets
ride
stuck.
trapped people upside down for nearly 4 hours.
That's a long time. That's a lot of gravity having blood pool in the veins. Oof.
Oh my goodness.
You could get nauseous, throw up, pass out.
Kids enjoying the July 4th holiday.
And hot. You got to remember July 4th's peak heat.
Were stranded when the ride stopped mid-air. Cheers erupted from below when the rescues started.
It took 4 hours to get a ladder.
The last rider was finally brought to safety 4 hours after the ordeal began.
It was the first ride 13-year-old Caitlin Lassiter and her friends rode. The Superman Tower of Power.
Oh my God, the names of these things.
I remember something else fell on us, which was more cable. We even had cables around our necks, and we pulled them off. Something hard hit our heads, and then we dropped.
Did the whole thing just fall apart and snap?
One of the ropes had wound its way around both of Caitlin's feet. This shattered her left femur and severed both of her feet.
Femur, that's one of the strongest bones in the body.
Her feet had now been completely cut off from the ankles below.
Oh my God.
At the hospital, the doctors were able to reattach Caitlin's right foot.
Wow.
But her left foot was too badly damaged to restore and had to be amputated below the knee.
The fact that she lost her leg, I mean, is terrible, but you could so easily lose your life when you're that high up, because these roller coasters are based on creating fear, and you create fear with heights and speed equal medical problems of... I hope no one's getting trampled here. That's like one of the biggest things with a lot of these acts. People getting trampled is obviously a huge risk factor when there's big mobs. And what happens is you essentially suffocate from all the pressure of the many people that are on top of you.
Authorities say 42 people were hurt when the partition separating the lawn from a secondary stage collapsed shortly after the show began August 5th, causing people to fall about 10 feet onto the concrete below.
That's so dangerous. I'm not gonna lie, I kind of had something like that happen to me where I was in Taekwondo and people were doing like this pile-up thing that kids do as a joke, and all these people got on top of me and one of the heavy guys got on top, and it was so bad. Not only did I hear like my back crack, but also I couldn't take a breath in. It felt like when I was on the F-16, I was experiencing 9.3 Gs, where I had to breathe in that very specific way. But obviously when you're 9, you're not trained to do that. And you have all these people on top of you, so very, very dangerous.
Latin pop singer Enrique Iglesias was performing Saturday night in Tijuana, Mexico, when this drone freak accident occurred during his performance.
Oh my God, why is he holding it? Don't hold the drone, there's sharp objects there. They always say stay away from the drone. He didn't expect for that to happen? That's terrible. You can get a really bad laceration, lose a finger like that. I love that they blow the confetti on him still. That's terrible.
The singer did run backstage for some quick medical attention, but then returned with a bloody hand and all.
Wow, that's a lot of blood lost from a hand. Hope he was able to see a hand surgeon quite quickly. Working on the hand is a tough job. You gotta be careful because there's a lot of very small structures that you can damage, and then if it doesn't heal well, the person may not have good use of their hand.
As members of the English rock band The Who, Moon and bandmate Pete Townsend developed a reputation for their onstage antics.
Oh no.
At the end of the show, Moon kicked over his drum kit as per usual, except this time it was loaded with explosives.
Oh! I did not expect for that to happen.
And permanently affected Townsend's hearing.
Explosions, the human body, they can't coexist. Hearing damage from incredibly loud noise at that level, at that decibel level, you're gonna have significant sensorineural hearing loss. You're gonna have traumatic barotrauma to the ear as well from an explosion like that, where the eardrum can rupture. It's important to note that it doesn't even have to be that loud. Here's a chart of how long you need to listen to certain decibels before it starts impacting your hearing, and it's quite scary.
Michael's downward spiral all started when he filmed a Pepsi commercial in 1984. He was on stage as the director called for pyrotechnics to go off all around him. They pushed a little too hard and Michael ended up in harm's way. The pyrotechnics went off and the flames were licking right at Michael's hair. It caught on fire.
Oh my God, that's not a part of the body that can resist burning. That sounds weird. Luckily, they put it out quite quickly, but as far as skin damage, it would be pretty significant.
Jackson was dismissed from the hospital today against the advice of his doctor.
He has both second and third degree burns of the scalp. Fortunately, the third degree component is relatively small.
Michael's injuries were horrendous. Doctors used balloons to stretch his skin, and honestly, he never fully recovered, and that's when he got hooked on painkillers.
I'm surprised they didn't start doing some sort of graft right away, but I guess that's because he left.
Keep in mind, this is 1984, a full quarter century before he died, and he became profoundly addicted to pain meds.
Addiction to pain medication is unfortunately common, worse over the last 20 years, given the really negligent role that a lot of pharmaceutical companies played in talking about the pain medications, teaching doctors about pain medications, rewarding doctors for the overprescription of those medications. And then on top of it, hospital systems essentially made pain another vital sign. And therefore, if you didn't get your patient to zero pain, it pressured doctors in order to control pain to a zero, which isn't always in the patient's best interest. Sometimes it might be healthier to get to a patient having a 1-2 level of pain than 0 because you have less side effects getting them to a 1 or 2.
Celine has been uncharacteristically out of the spotlight, battling a terrifying disease.
It's hard to watch.
Yeah, she has a very, very rare condition called stiff person syndrome. It's a rare autoimmune neurologic condition where you get these incredibly painful spasms. And I'm not talking about stiffness like you can't get out of bed because you're feeling tight. These are debilitating.
She was at her doctor's for a checkup when a seizure swept over her. She tried to laugh it off when she felt the first signs in her fingers. Soon, she was in the full throes of a medical emergency.
Brian, I need you right now. She's in a crisis. Lift her. Yeah, right. 1, 2, 3. She might be in spasm. Yeah.
So during the spasm also, you can get pretty significant muscle damage, leading to breakdown of muscle tissue and therefore enzymes into the blood, which can impact your kidneys. So a lot of issues can arise out of this.
She's given a sedative in her nasal passages.
A lot of the treatments that they use in situations like this are benzodiazepines to relax the muscles. What is thought to be the mechanism of why this happens or how this happens is this autoimmune condition basically prevents you from having one of the neurotransmitters known as GABA, which actually helps break muscular activation and cause muscular relaxation. So you essentially don't have enough of that neurotransmitter. Therefore, when a muscle activates, it can go unmitigated and just continue spasming away.
After 10 minutes, she's recovered. Sadly, she'll experience similar attacks many times as she battles the incurable disease.
That is an important point, that it is in fact an incurable disease at the moment.
Valentine's Day for little monsters. As we learned, Lady Gaga has canceled her remaining tour dates and needs surgery. Yesterday, Gaga revealed she needs surgery for a labral tear of the right hip.
This is an injury that in younger people happens as a result of a trauma. In older people, it happens as a result of kind of overuse. The hip is a ball and socket joint. Inside of the hip, you have the labrum, which is this fibrous cartilage that allows the bone to move inside of it very smoothly. Now, you can develop a tear tear there. But the thing about labral tears of the hip is that they don't really heal. You might be pain-free from it and it might not be bothering you, but they don't really heal. Many patients end up trying conservative management, physical therapy, and it does work, but ultimately some patients may end up needing arthroscopic surgery where they go in and they clean out that labral tear.
Last year when I played this same beautiful place, I was so badly injured. And I remember I was dancing, I was doing Scheiße with that big castle behind me, and I was in some kind of pain, I'll tell you.
It can be really, really painful. I've had patients that were so debilitated they couldn't walk as a result of a hip labral tear. That might remind you the fact that there's also labrum in the shoulder that can be torn. Mine's torn in multiple places. But again, with physical therapy and conservative management, you may not need surgery. Let's take a minute and talk about ShipStation, the fastest, most affordable way to ship products to your customers. These days, everything in my life is getting smarter. Got a smartphone, smart TV, my doorbell's even smart. So if all of that stuff is getting smarter, why can't shipping get smarter too? That's what I love about ShipStation, who can make your shipping process so much more efficient, whether you're sending out things like artwork, coffee, or merch like I do. You see, your entire shipping process can be managed in ShipStation's easy-to-use dashboard, which integrates so well with your shop on Amazon, Etsy, eBay, Shopify, and plenty of others. They allow you to automate your shipping process no matter the size of your business, whether you're just getting started or you've grown into a full-on enterprise. Over 130,000 companies have grown their e-commerce business thanks to ShipStation, and 98% of companies that use them for 1 year become customers for life. Not to mention, you can get up to 89% off USPS, DHL Express, and UPS rates. Lead your e-commerce business into a smarter future with the shipping software that truly delivers. Go to shipstation.com/Dr. Mike to sign up for your free 60-day trial. All right, let's get back to the music.
As the clock ticked down to Travis Scott's arrival, tens of thousands of fans crammed into the venue to see the rap star perform.
This was a big story.
Concert goers told NBC News that around 8:30 p.m. the crowd began to compress and push, making moving, even breathing, difficult. Houston police say they first received reports of people falling injured around 9:30 p.m.
These days, with people having cell phones, how are they not contacting 911 instantly and 911 shutting down the show instantly?
By 9:38 p.m., a mass casualty event has been declared, and Live Nation agrees to cut the show short. 8 people in the crowd died that night, their ages ranging from 14 to 27.
Yeah, this seems like just negligence across the board as opposed to a single individual. But at these concerts, you have to be so safe because you have to think ahead. Sometimes you can get trapped in a situation where at that point, you have no more action. So you have to put a lot of forethought into where you're gonna be, if it's safe, are you gonna be well hydrated, especially when people wait hours and hours online. Electrolyte abnormalities happen. Sometimes people are using illicit substances. Very, very dangerous situation.
Taylor Swift is giving fans a health update amid her Eras tour.
Oh no.
Taking to Instagram on April 24th, the singer captions a series of photos of herself on stage.
It looks like a fall on an outstretched hand.
Tripped on my dress hem and fell in the dark backstage while running to a quick change. Braced my fall with my palm. It was all very Mercury and retrograde coded.
Interesting. I will say that's also one of the common ways that people break their wrist, their scaphoid bone. So I hope the doctor examined her hand and made sure that that wasn't the problem.
The show will go on for Adele. The British songstress has undergone throat surgery that has been dubbed a success, and a full recovery is expected.
It's got to be some kind of vocal cord surgery. Her pipes are just like, ah! Hello.
The London-bred Grammy winner underwent laser microsurgery in Boston to stop recurrent vocal cord bleeding from a benign polyp.
Yeah, so vocal cords are known to develop polyps, which functionally can impair the vocal cord's ability to function. Part of it is a healing process, during which we're also telling patients not to speak loudly or whisper, because whispering makes you tense up your vocal cords. You also want to avoid this constant throat clearing because that can actually irritate the area as well.
Adele recently revealed that she collapsed backstage at her Las Vegas residency after suffering a flare-up of her spinal condition. At one of her weekends with Adele shows, the singer told the crowd that she fell and was unable to move because of a sciatica attack.
For those who have ever had a sciatic attack, it is debilitating. It hurts to move, it hurts to cough, it hurts to breathe. There's rarely a simple position of comfort. And the sad part is that I want to help patients in these situations. And besides doing some pain management, maybe some inflammation management, there's not great evidence for a lot of medicine, or even treatments, that is. Spinal surgery is not great unless there's very clear evidence of nerve compression. People use steroids, like oral steroid medications to control the inflammation. That doesn't have great evidence behind it. We frequently give muscle relaxers for sciatic pain. Also doesn't have great evidence behind it, but does make people sleepy as a side effect. So people use that for that. And then obviously just using regular pain control, you want to not get into the situation where you're using opioids because they're highly addictive and cause other problems, as one being an example, constipation. For me, it's about limited bed rest, allowing the body to heal itself, getting up and out and moving as long as you're not hurting yourself, making sure that you're starting the rehabilitation process early and safely, and you're doing some activity modification so you're not re-injuring yourself. Boy, is it a hard condition to treat because it's all about the compression of those nerves, the irritation of those nerves. If you've had it, you know.
Saying in a 2021 interview with The Face, "I've been in pain with my back for like half of my life, really."
Same with me.
And Adele also saying that her sciatica can flare up from stress.
Yeah, so sciatica really hits you when you're at your lowest. And a lot of that has to do with when you're stressed, you're also not taking care of yourself. You're not sitting and resting in the correct postures. You're resting less often than you should, so you're already prone to more injuries. And when you're overworked, stressed, your odds are not working out and not doing the preventive measures to not have a sciatic flare. That's not to victim blame, but it's just to know what leads up to a sciatic attack.
What injury led to you peacing out?
When I tore my growth plate in my hip.
Oh, I wonder if that's traumatic.
This horrible pain here and in my lower back and in my shoulder and in my neck.
I wonder if those are connected. I think not.
I don't know why, dude. I'm 17 and my body is broken.
If it's not traumatic, there is a condition that happens in adolescence, around ages 11 to 16, called SCFE, S-C-F-E, slip capital femoral epiphysis, where the growth plate starts slipping off the bone. It's very painful and it results in this waddle of a walk.
I am very flexible. My back is my splits are way insane.
So remember, with great, oh my God, I'm gonna do a Spider-Man quote. With great flexibility comes more injuries. So you gotta be really careful with that.
I've sprained this ankle 6 or 7 times. I sprained this ankle twice.
Yeah, it sounds like we have some kind of ligamentous laxity here. Maybe Ehlers-Danlos is a condition that ought to be discussed. I'm sure it was with her healthcare professionals.
Pyrotechnics are all well and good until they explode in your face. During a rendition of Fade to Black, Hetfield became confused as to where he was supposed to stand and accidentally walked directly into a pyrotechnic blast. The flames engulfed the left side of his body, leaving 2nd and 3rd degree burns on his face, arm, and hand.
In a situation like that, the face obviously is something we're very nervous about, but then the hand as well, because the hand can develop contractures after a burn and therefore make it very difficult to use one's hand. And also based on the amount of body that was burned, you're going to be needing to stay in the ICU due to electrolyte issues, dehydration, infection risk. In fact, we use this score of 9s to judge based on the percentage of body that has been burned to decide whether or not someone should go to the ICU. Here's that chart.
Big Boy rose to prominence in the late 90s and early 2000s. We're here because in May of 2013, he blew out his knee on stage while performing at the Summer Camp Fest in Illinois.
He probably hurt his meniscus there. Maybe there is a cruciate ligament, an anterior cruciate ligament issue as well, but more likely to meniscus based on mechanism of injury.
It was later discovered that he'd torn his patella.
God, I hate when people give me histories when they're not medical. The patella is a bone. No one tears a bone. There's a patellar tendon that can get inflamed and you could develop tendinitis, and there's a patellar tendon tear. But interesting, maybe he was playing a lot of basketball beforehand.
During a concert in Gothenburg, Sweden, Foo Fighters frontman Dave Grohl took a tumble off of the stage and broke his leg.
I think I just broke my leg.
Are people booing the fact that he broke his leg? Are they mad at him?
Grohl returned a short while later sporting a cast on the injured appendage and finished the show. Grohl wasn't going to let that pesky injury derail the entire tour, so he designed a massive throne for himself.
I would just eat until I'm dead, probably. A normal day for me is wake up around 12, figure out something I'm going to eat immediately, TV, video games, bed.
So it's interesting that you see him drying himself off with the towel in that specific way. When you have excessive body weight and you have excess skin, excess fat tissue, you have to be really thorough about drying yourself because it's really easy for a candida infection to begin. And as a result, you can get really bad redness, irritation of the skin. It can then become a full-on cellulitis where bacterial infection sets in. So it's really important to dry skin folds in order to decrease the likelihood of this happening.
I never would have thought at 34 I'd be living with my father and I'd have no job, have no real money, and just be playing video games all day and eating.
When you're trying to address someone's situation where they're morbidly obese, you have to look at the patient as a whole. You have to look at what are the reasons that contributed to this occurring. What can you do in order to prevent it from recurring? Look at triggers, look at mental health factors, look at sleep schedules, daily activities. Like in general, I'm not against gaming. I love gaming. I consider myself a gamer. But there are times when we can take something that can be potentially beneficial and make it into something that it's not. And this can happen with anything. I mean, it's really the dose decides the poison. So having an unhealthy relationship with food, with gaming, all of this can contribute to this ultimate unhealthy lifestyle, which will ultimately decrease lifespan and decrease quality of life. And that quality of life is really what I like to focus on. Because yes, we want to extend lifespan, we want patients to live a long life, but at the same time, I want them to live that life comfortably. I don't want them to be in pain. I don't want them to be in mental anguish because they don't feel like they're connecting with the outside world. And that's what a good doctor, nutritionist, or like I said, any other health professional looks at when addressing these types of problems.
Hey, so I got your food. Okay.
He'll tell me what to get him, and I come right back a lot of times in case that's too much food. But I'll get it for him and bring it to the house and put it right in front of him.
I don't want to call him an enabler, but I mean, sometimes that's really the way it seems that it is. I'm not buying the groceries. I'm not buying the frozen pizzas. I'm not buying the chicken wings. There's someone facilitating the food coming in, and it's not me.
I mean, there's partial truth in that. I don't think that's a valid excuse for someone to make. If my patient told me, hey, look, it's not about me, I'm not the one doing the shopping. At the end of the day, there's a level of personal responsibility involved in all this, but to solely place the blame at the foot of others is not a healthy pattern. Not because it's right or wrong, but because it takes away control from you. And when you take away control from you, you actually create more of a problem where you feel like you're helpless, you have to do it, and there's nothing you can do to change it. When that is not in fact reality, there are things you can do to change it. There are conversations to be had with your quote unquote enablers, because the foods that are being consumed are A, unhealthy foods, B, there's salt being added to already very salty foods, the portion sizes are tremendous, and I saw the father mention tea. That tea has so much excess calories from the added refined sugars. Like, that's even worse than eating a huge amount of food, because at least when you eat the food, you can feel satiated and there's some fiber and other nutrients in there. But when you're just drinking sugar water, which is essentially what a lot of these sweet teas are, in mega amounts, you're just adding weight.
So I bathe outside this trough currently because I cannot physically bathe in a sit-down bathtub or stand-up shower area. Because I'm a bigger guy with like folds and flaps, and I have to move around like almost like a pig in a way, and wallow and roll over to get like the back of my leg. I have to lift up literal like pieces of skin. It's just a super difficult process.
There's a lot of adjustments that are needed to be made in someone's home when they are of this excessive weight. There's also adjustments that need to be made in the hospital. I've had patients who are morbidly obese who unfortunately did not fit in our CAT scan machines and our MRI machines. And in those scenarios, A, you try and look at the facilities around you if there's an option to transfer the patient that someone does have a larger piece of equipment. And then there's sometimes been situations where we literally have to contact our local zoo who have really large machinery for some of their larger animals, and we use those. It's not a pleasant conversation to have with patients, but it goes to show how there's a lot that needs to be done in order to make sure that we're keeping folks like this healthy.
This is an icebreaker. We do have to take your weight first.
This is coming. When I weigh myself in my house, I do it butt naked, just use the bathroom, number one, number two. And I've like tried to throw up the last meal I ate so I can lose any pounds. Now I'm there wearing clothes, I'm kicking off my flip-flops, anything I can get off of my body to lower the number, because I know it's gonna be shockingly big.
It's 711.8.
Now, I know some bariatric offices that try and save this step for later in the visit. Reason being is, whether this patient is approximately 500, 600, 700 pounds, we know that there's gonna be a benefit to doing the procedure. So we can already lead with that assumption. A lot of times it's traumatic to step on this scale and look at the number, so we try and perhaps save it for not the first thing you do when you walk into the office, because that alone can cause people to not want to come in to see the doctor in the first place.
We're at a critical stage here. You're gonna die pretty soon, unless something happens here.
Now, I know that's jarring to hear. I understand why. I agree with this approach. I think this is the most successful approach because it's honest. Whether you have a patient who's morbidly obese and is over 700 pounds, or you're recommending a do not resuscitate order for a family member. Those are difficult conversations. The truest, most honest, non-judgmental way you could deliver that news is gonna be the most successful way you could deliver that news.
With you, the route we're gonna go down towards is a sleeve gastrectomy.
Okay.
All right? So, this is your stomach.
Gotcha.
All right? What we're gonna do is we're gonna go in and we're gonna remove this outer portion of your stomach right here. There will be a metabolic switch that gets flipped in your body when you have this surgery. Your body will want to lose weight.
Yeah. When Dr. Proctor was going over to surgery, it was pretty scary, only because I fear surgery in general.
Understandable that he's apprehensive. Surgery comes with legitimate risks, even if it's bariatric surgery. That being said, being 700 plus pounds carries way more risks than the surgery. And that's how we decide whether or not a procedure, a medication, a treatment is good for a patient.
Why don't you tell me, what does a normal day of eating look like for you prior to when you saw Dr. Proctor?
So like, we're waking up at like 12.
Okay.
And then probably ordering food from the hot dog house.
What do you usually order?
On like a normal day, it might be like 20 wings or like 10 tenders, and then it would be like a small order of tater tots and a large sweet tea.
This size cup?
Yeah.
Okay. So we're doing 32 ounces of sweet tea?
My lunches were either a taco salad or like tacos.
Okay.
But it was, you know, not a lot of sour cream.
And then were you having dinner?
It could be anything from like a big thing of fried chicken or pizza. We'd have like, not occasionally, but sometimes.
So Dr. Proctor wants you to lose 60 pounds by the time he sees you next.
The reason why all of these guidelines are in place about having patients lose a certain amount of weight before the surgery, having them see a psychologist, running blood tests, is you want to set the patient up for success. If we just willy-nilly did bariatric surgeries on everybody who is obese, it would be problematic, because what happens is when you do the surgery, there's very specific protocol you have to follow. If you overeat with a smaller stomach, you can actually cause surgical issues. You can rupture your stomach, you can cause vomiting, it can cause mental havoc, it can lead you to going into a dark depression. We really try and select our patients that we think are gonna have the best outcome from the bariatric surgery instead of just recommending it for all.
So I've hired a personal trainer for the first time in my life. This is the first time I've been to the gym in a long time, and I am a little bit nervous. Hey, what's up, man?
Casey, right?
Yeah. Dex?
Yes, sir. How you doing?
When I watch programs like this on TLC, my one issue that I have is a lot of this is not reality for most Americans. I don't want someone who is potentially wanting to lose weight to look at this and think that unless I have this, I can't lose weight. It's not true. You don't need the diesel personal trainer in order to lose the weight. Any kind of physical activity when you're going from zero will help. Also, being kind to yourself and not pushing yourself too hard in the beginning is also really important. With someone who is 700 plus pounds, you really want to make sure that you're focusing on injury prevention. It's very easy to overload joints, to pull and hurt muscles, and as a result, you can set someone back. So it's really about starting slow.
We're gonna do arm rotations,
Okay,
15 each
so
way.
All right, gotcha.
Good, now we go back the opposite way.
All right.
I had Casey move his own body weight so he can establish a correlation between what he's accomplished already and what he can expect himself to do in the future.
See, like someone might look at that and say, that's not exercise. Yes, it is. His heart rate's going up, his breathing rate's going up. This all automatically kicks up the metabolism, helps him prepare to meet the challenge. And he's been sedentary. You can't push too hard too fast. You can put too much strain on the heart and even cause a heart attack. There's actually a type of heart attack called a type 2 myocardial infarction that happens as a result of not a pure blockage, but simply because there was so much strain on the heart that there wasn't enough circulation going that actual damage has occurred.
It's been 3 months since my surgery and I feel good. Little things are changing in me that I didn't really expect to change so quickly. As I accomplish more, My self-esteem is rising, so I feel like I can do more. So it's just a good feeling. I started this journey at 711 pounds, and today I'm happy to say that I'm at 525.
I think it's great when you start seeing your goals pan out, and that's how motivation happens. It's seeing your hard work be paid off, and it might not happen off the first, second, or third time, but as you continue, you keep seeing that you're making improvements, whether it's after a week, after a month, or after a year. And even for myself, I had a buddy that was in the ICU recently and had a lot of neurological deficits, and as he was slowly recovering, he would call me each day, upset the fact that he wasn't making progress, and I had to remind him, write down what your deficits are today. Do it next week, do it the following week, and then each time you're upset, look back and see how much you've improved. When you look in every hour by hour, day by day, sometimes it's easy to lose sight of how much you've accomplished, but when you really spread it out and think in scale, which we as humans are not good at doing, you get to see the accomplishment. You get to feel motivated. You get to see that you're making moves in the right direction, even if it's 3 steps forward, 1 step back.
Well, I'm trying to get my license renewed.
This is him now?
Because on the 20th of this one. Because on my other license, I'm huge. I'm a whale. So there we go. That's me. I don't know if you can see that real well. I don't know, but that's me. It's really weird too, because like 2020 Corona is like the worst year of some people's lives. Like it's really been awful for people, but like it's going to go down in the record books as like one of the best years of my life, probably. Life for me is blossoming.
What he's experiencing right now is almost like a form of post-traumatic growth. It's looking back at your accomplishments. There's nostalgia there. And the fact that he's in fact reached his goal. He's in fact improved his quality of life. It goes to show that everything that we discussed in the beginning of this episode, where it comes to extending life and improving quality of life, he's a walking testament.
Take out the branch. Can't take out the branch, you'll bleed out.
That's good advice. You never want to take out any object that's inserted into you or gets impaled into you. Taking out the branch is a bad idea. If someone's bleeding out, the first thing you want to do is apply as much pressure as possible. If that's not working, you have to create a tourniquet. And a tourniquet can be made from anything. You can rip off a shirt sleeve and wrap it around the area. Just remember, you have to go closer to the body with the tourniquet from where the wound is. So for example, if the wound is right here, you want to put the tourniquet on here.
His renal artery is cut. I'm gonna clamp it. We're gonna use his blood. Start a line. Go, 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 go.
Maybe this is something you learn when you're learning about war trauma. This is not something I've ever been taught. This sounds ludicrous. It looks ludicrous. It's giving me the heebie-jeebies. I hope no one does this as an EMT. Patients go wild like this. It happens, especially those under the influence of drugs, alcohol, that sort of thing. This is heavily underreported. Healthcare worker abuse, whether that's nurses, doctors, PAs, pharmacists, whoever it may be, get abused often, and often meaning more than it should. And it doesn't raise any headlines, it doesn't raise any alarms, but it needs to. We shouldn't have to have patients yelling at us and punching us and threatening us and throwing things down because we're there. Tension between doctors and administrators definitely exists. I wouldn't say it's this bad. Generally though, everyone has the patient's best interest at heart. Not everyone is so money hungry as they're making this gentleman out to be. They definitely think about profits more than they should, but I don't think they would ever put in jeopardy a child's life, especially a baby's life. The difficult part about being a hospital administrator is that you are constantly forced to make a decision. Let's say keeping the baby will cost you so much money. These types of losses will become larger and larger, and then the hospital will be forced to close down. You're hurting thousands of people, if not millions of people. I don't know how many people come to this hospital, but it's a tough decision. It's not an easy position to be in, so I don't envy that job. But like I always say, be a human first. Hospital administrator, doctor, whoever you are, human first. Gunshot wound, taking out the bullet is not the most important aspect of treating someone, because just taking out the bullet doesn't stop the problem that's going on with the patient, and that's bleeding. So you need to control the bleeding, and in order to control the bleeding, you need to find the source of the bleeding. So pulling out the bullet is one step, but there's a lot of people that still have bullets even in them because we stopped the bleeding and there was no medical need to take out them. With being too altruistic and there is such thing as being too altruistic, is you become an idealist. And at times as a doctor, you can't become an idealist. You have to be rational, you have to be practical, you have to be quick thinking. If you constantly put your hospital in the red because you either over-order tests or you perform procedures that won't be covered by insurances, you can bankrupt the hospital system and force the hospital system to close and then hurt so many more people. In Atlantic Health System, Overlook Medical Center, where we have a fantastic charity care system, that if someone makes a small amount of money, is uninsured, they can almost be seen for free. I mean, some of the charges, like to see a doctor is like $10 or $5. They're very low. If you're ever faced with this dilemma, you don't have insurance, you think you should get checked out or you want to get checked out, it doesn't mean because you don't have insurance, nobody's going to take care of you. Figure out a way to get seen. Talk to social workers, talk to government employees. There's usually a program that we can tap to get you the help that you need. Administrators, but I agree here, in Afghanistan or in a war zone, you have no choice. If you don't act, this person dies. So even if you're not giving them the best quality care, you're doing the best that you can in that moment to save their life. But in a time where you pull up on the side of an accident, non-sterile, the best thing that you can do for the patient is get them to a hospital as soon as possible, not to perform surgery in the... I don't know why I'm so frustrated with this show. He was a doctor in Afghanistan that performed neurosurgical procedures / surgeries and was bad at them because he wasn't trained to do them. It doesn't sound surprising to me. I don't follow the logic. This show is not for medical folks.
Nick, get him to recovery.
0.38 alcohol level is very, very, very high, just so you're aware. Very, very high. I'm talking about like a bottle and a half of vodka. People make mistakes. You have to treat everyone, whether or not they're a criminal, not a criminal. It's not your job to figure out who's right and who's wrong in each situation. As a doctor, you take the Hippocratic Oath for that exact reason. You will treat anybody, regardless of their race, religion, criminal status, not criminal status, war criminal, not war criminal, everybody. You can't be deciding and playing God who you are and you aren't saving. Just imagine the pitch meeting for this TV show. It's like, we need a very rare condition for this young girl to have where she has some sort of other human being living inside of her. I've heard of stories like this before, but they were just a case study, which just means one person out of millions that have this condition. It's a pretty rare condition where basically the tumor is your twin that died but didn't survive, but still lives inside in this little tumor. Well, lives is a bad term. There's also tumors that exist known as teratomas, which basically arise from the cells in your body which are responsible for growing specific other types of cells. So within a teratoma, it's not unusual to find fingernails, hair, really abnormal stuff, and these teratomas can form anywhere. Imagine finding teeth in your arm. That's what a teratoma is like. Well, that was not a medically accurate show, but it was quite entertaining, lighthearted, fun, and I could see why a lot of people would enjoy it. So I appreciate you guys sending me the recommendation. I will have to say there's not a lot for me to comment medically on this episode because the conditions that occurred here were very dramatic and rare, and the way that they perform some of these things is just not realistic and not how most hospitals would handle things and administrators would handle things. But, you know, it's a fun, upbeat show, and it's like a hoorah army show, and I dig that. I'm all about supporting the troops. If there's an episode that has more medical stuff that you think is questionable in its accuracy that you want me to look into, please leave it down below in the comments, because you know I'm all about taking your suggestions. Click that subscribe button down below and make sure.
But you have more experience than me.
I have no experience here.
What do you mean?
I just have a higher IQ.
That I believe, but I also know that you have a lot of experience gauging prices if they're fair.
Yes, I hear a lot of prices, but I don't know this category.
Whoop. Black gray yoga mat. Maduka's GRP mat is a staple in slip prevention. We believe that's a thing. Plus, good cushion provides support and stability for your practice.
You could say that about any mat.
That's what I'm saying. But I'm assuming it's going to be like I'm not going to give you any tips.
Because of where it comes from, it's going to be ridiculously priced.
Well, because it's going to be bougie. I knew it was going to be over $100. Well, that's a ridiculous yoga mat. Would you invest in that?
I'll tell you what, if you printed it with Kevin Costner butt naked laying down that I could get on top of every morning, I would pay $1,280.
Roebling blue light glasses. These glasses filter blue light to ease up on the potential negatives of spending too much time with screens and other sources of blue light. This pair is non-prescription, anti-glare, and virtually clear.
I'd fall for that. Is that a fake?
Well, I'll tell you the truth about blue light and blue light glasses. The research says one thing about blue light, and that is it affects your sleepiness hormone. So if you expose yourself to a lot of blue light before bedtime, it can make you not sleepy. As in your phone, TVs, things. Because there's blue light in sunlight, and there's a part of your brain, the suprachiasmatic nucleus, that responds to the light to make you feel more awake. It resets your circadian rhythm.
Right.
So it shuts off that hormone. But then a lot of these companies, like this one, saying it's good for your eyes in general, that's a little bit overstated. Wow! Did Goop become reasonably priced all of a sudden? I've always thought that they rip people off. Detox Super Powder. Garbage. This daily shot of detoxifying nutrients and botanical extracts benefits both skin and body by supporting the liver's own detoxification processes. It was formulated to help fight the formation of free radicals caused by poor diet, alcohol, stress, and environmental toxins.
That's everybody.
The formula's ingredients work synergistically to help neutralize dietary and environmental toxins for healthy, vibrant skin. And a big asterisk there that says, these statements have not been evaluated by the FDA. The product is not intended to diagnose, treat, or cure or prevent any disease.
Yeah, you know what it's like? It's like on Shark Tank when people are talking too much, you know they don't know anything.
Oh, Goop is reasonable.
I'm not playing. I'm not playing.
You're still in the lead.
I don't care. I'm not playing.
The word detox on its own, it makes me want to vomit. Because
Really?
it's not real.
It's so used all the time, detox.
Well, because it
detox.
sounds so sexy.
Yeah, it does.
But our organs detox us.
Oh.
Not the supplements.
Even after alcohol?
Yeah. In fact, if your organs didn't, you die of alcohol poisoning.
I'm not going to lose.
2-1, baby. Let's go. What is an ear seed kit? Oh, my.
It's another long one. I hope you have a
In
lot
traditional
of time.
Chinese medicine, the ear is considered to be a microcosm of the body with hundreds of acupressure points supporting the body and mind. Ear seeds are one way of stimulating these points. Use the specialized tweezers to gently place the 24-karat gold-plated seeds on the ear. For a little more flash, the set comes with Swarovski crystal ear seeds too. As a shark, would you invest in this?
No way.
What do you
No
mean?
way. It's wacky. Wonkers.
Yeah.
Show us your stuff.
$45 for gold? Get out of here! Did you buy this product? How did you get? No, you didn't.
I swear to God, it's a lucky guess.
No, you knew.
No, how would I know? Oh, God.
Oh, it's another yoga mat? The Healthy Line Rainbow Mat is filled with 7 types of natural gemstones. They warm up with far infrared heat to become a hot stone surface that can help you relax. Hang out at the top of the mat, and you'll also have the option to bask in pulsed electromagnetic fields. The rainbow stones are nicely suited for any practice involving your chakras. A heated mat is fine. Like, I like it. But why do they have to put the stones and make it about the stones?
To sell more.
To sell more. Get out of here!
You gotta be kidding. You know what? That's a loss leader. It's just to get publicity. Don't believe it. Nobody orders it.
Really?
Yeah. You do it all the time in business. You
Really?
name it out. I used to do it in real estate. I used to take a property that was worth $850 and say it was $7 million, get the press in to see it.
And the press would be like, why is it $7 million?
Yeah, and then you drop it to $850 and sell it because you got all the press. Wow. Same thing here. Nobody's buying
You're a
that
shark.
stuff.
$1,900 for a
Just
mat.
remember what the score is. Forget about the mat. Remember you're losing, I'm winning.
Yeah, this is 4-1. I don't even have a chance.
Oh, boy.
Okay. You wear the ring on your finger and it picks up data on your body's natural signals, things like heart rate variability, and body temperature. It provides you with cumulative scores for sleep, readiness, and activity.
Isn't that dangerous on your finger all the time? Think about that. A little computer on your finger all the time?
Well, I mean, it's better than having the thing that Elon's trying to implant in our brains.
Yes, I know. On season 1 in Shark Tank, we had a crazy guy come in.
Implantable Bluetooth technology. Here's the surgery locations.
Darren, I have a problem with that. I am out. This is the weirdest damn thing I ever heard.
So let me just give the medical context. I think tracking stuff could be good, but long term, we don't see it change behaviors.
Wow, that's what counts. It's called bottom line.
Oh, I win one. Okay.
It's so much more fun winning, isn't it?
Yeah, it is. What is a pelvic clock?
Crazy.
The pelvic clock is designed to help increase flexibility in the lumbar spine, improve hip mobility and alignment, relax tight hip flexors, and strengthen the core, with instructions based on the face of the clock, like rocking your hips from 3 to 9 o'clock.
How annoying.
So it's a piece of plastic. It might be good, I don't know medically, but
I would have to say, as not a medical person, it's terrible medically.
why?
Because it's just a gimmick. Come on. You can-
Yeah, like you could just stretch.
Yeah.
Right? Like
How about that?
It seems unnecessary. $84 because they put on a toilet seat pelvic clock.
Who cares? I won.
Wow. Oh, I hate these things. This posture corrector, which can be worn over or under clothes, puts gentle pressure in the right places to draw your shoulders and chest into the right position. I don't like these things.
Why?
Your body can be trained to have healthy posture by using the muscles.
Oh, this doesn't force you to use the muscles.
This
it doesn't work for you.
So your muscles detrain and your posture gets worse. Oh my God!
That's a good deal.
That
I'm
is a
wearing
good
one.
deal.
I don't care about my muscles.
You're like, I don't care if it even works. It's a good deal.
You know, that could be
It's a piece of Velcro.
That could be sexy in the bedroom.
No, it's not. It's limiting in the bedroom.
It depends what you're into.
That's true.
I'm going to give my husband a heart attack and come show up in that.
For $20 with a Velcro strap.
He's going to say, is it my birthday?
Vitamin C booster. This brilliant bottle is pure powdered vitamin C, which added into your daily serum treatment brightens and even helps your skin look healthy and supple. Because a lot of people do this, like, I'm going to boost with vitamin C my immune system. Have you heard that?
I have heard, but it works, doesn't it?
No. You know when we say boost immune system? A boosted immune system is an autoimmune condition.
Really?
Right? Like psoriasis, that's an autoimmune condition. That's when your own body attacks itself.
Yes.
That's a boosted immune system.
Wow.
Do you really want to boost your immune system?
I don't think so
No.
anymore.
No.
Yeah. It sounded so good at first.
I know. Ah!
$90.
The priciest vitamin C money can buy. Therabody Power Dot. The device uses stim to temporarily relieve muscle pain due to strain from exercise and everyday activity. It'll send out small signals to your muscles and sensory nerves, a process designated to stimulate muscle contraction and temporarily relieve muscle pain. You know, those things are like good if they're targeted for the right things, like if it's part of a PT regimen.
Really?
Well, because the goal of activating a muscle is to stimulate circulation, because circulation heals. So maybe if your muscle's really injured and you want to gently stimulate it, this could be a good way.
Why don't you put down $500? Put your money where your mouth
Okay,
is.
how about this? $4.99.
$4.99? Okay, I'm going to do something else here.
She's gonna go $1. Oh, she won!
By a buck or something?
By $1 or $2?
Yeah. Oh, I can't imagine where this ring goes. Ballast 10-pound wheel-shaped hand weight is made for versatility. Curl or press it like a dumbbell, swing it like a kettlebell, throw it into your Pilates routine, or add it to squats and lunges. It's made from recycled stainless steel and covered in a super soft silicone, ergonomically designed, weight distributed, all good stuff. It's actually a fine product, I'm sure.
I actually have something like that.
Yeah,
It does work.
I think that's a
much
good-
larger than what I have. somehow.
Well, it's funny we say work. It's a weight.
You know what's great about it? If you're traveling, you throw it in your bag. It works with pressure. You could.
Yeah.
You don't have to bring your weights.
I would use it. Not if it costs this much, though. Oh, the pricey 10-pound circle.
Touch.
Skyview Wellness Table.
Oh, that's nice.
That's a cute lamp.
Yeah.
Well, let's hope they don't make promises. This lamp cycles through lighting modes designed to provide optimal circadian stimulus. During the day, it provides the wavelengths that support alertness. In the evening, it removes those light signals and transitions into sunset and nighttime modes. I'm not mad at it. I think it's going to be crazy expensive.
Think so?
It's also like a piece of furniture, and furniture's wild. Oh, I knew it was expensive.
Whoa!
Yeah.
For that?
Yeah. Yeah.
What a rip.
Air filter. What's beautiful about this air purifier is that it uses natural biodegradable resources to filter the air. 3 types of filters are included: reindeer moss, coconut coir fiber, silk matrix. The air filter is so small and compact, so it maximizes the space in your home. So my only issue with this is it's not a HEPA filter, so I don't know that it's guaranteed to remove allergens and all this stuff.
Do you have to change it all the time?
I don't know. Where do you get coral and reindeer oats or whatever?
Yeah. How long could it last?
Oh, well, the mat last time was $2,000. Oh, okay.
Now we have to write.
He jumps 228 times in 30 seconds? Quick math, 8, just under 8? 7.6743? Definitely doing it wrong. Whoa! He would make a good Irish dancer. I just want that to be me and my problems to be underneath me and just how I would behave if I walked into a room full of cockroaches. Trying to create a meme out of it. Oh, why would you do that to your scalp? I mean, it's a great exercise for your low back, but you could just use straps without doing that to your scalp. Hair is very strong, but unnecessary to do that. World's strongest hair. Did you know that we're actually in the Guinness Book of World Records? Check it out. Looking to relieve facial tension? Watch my meme videos. What? Huh? What did I just witness? The horror. Especially during residency. Absolutely. Oh, this is a nurse. So yes, every day is a hard day. When I see guys in the gym locker room staying up to date on their COVID vaccinations. They're just getting their flu shots. But why are they getting it in their butts? Probably steroids. Best hack to motivate yourself to run. Run every day for 30 minutes. If you miss one day, add 30 minutes to the next. It works really well. Tomorrow, I'm running for 3 weeks. Honestly, start slow, work your way up. Forgive yourself if you miss a day, move on.
Everyone always makes fun of white people for not washing their legs.
Do people make fun of white people for not washing their legs?
I don't get it. It's like the runoff water does the job. Like,
I've never actually washed my legs.
I wash my legs, I think. Sometimes. I mean, if there's something on them, if I got like a little dog drool on them. No, you scrub the legs, especially dry skin. You want to use the loofah on there to do a little light exfoliation.
We got greenhouse, we got tiny house, we got big house, we got house cat, we got dog house, we got outhouse, we got Amazon warehouse, we got Sprouts.
What's
we got
Sprouts?
Horse, we got hose, we got International House of Pancakes, we got Full House,
Oh my God, this is so
we got
good.
Frat House, we got Houseless, we got Outback Steakhouse,
Oh my
we got
God.
Haunted House, we got Gingerbread House,
When will
we
it
got
stop?
Bird House, we got House Arrest, we got Lighthouse, we got Can't Afford a House, we got Hype House, and we got Doc.
Let's click from Adam's. Heart attack.
Mire vársz? Gyorsan hívd a 112-t.
I don't know what language that is, but I agree.
Egy másodperc alatt kétszer nyomd a mellkasát.
Okay, that sounds good too.
Találd meg a saját zenei stílusot.
Yeah, staying alive.
Akkor nyomjuk neki.
Okay. Is this the person from a meme? Oh, okay. This is the best educational clip I've ever seen for chest compressions. Better than mine.
I will survive.
Copyright killing the channel until we stay alive. Oh. Oh, we got Shakira? See, that's what I want playing when someone's trying to bring me back to life.
But isn't that great? The guy, you've reacted to so many memes with that guy as a
Yeah.
doctor.
And now he's a doctor saving lives. Can we hit up and ask if we can borrow that? Can we borrow him?
Did you give it yet? Yeah. I'm actually giving him the last vial right now.
What do you mean the last vial?
There you go. What? What? You said to give him 3 milligrams of epinephrine, so I gave him 3 milligrams.
I said
0.3 is the dose that we would give during anaphylaxis.
Oh no. I feel alive! Easy, just calm down. I can see right through you.
That's not what's happening. What's happening is the heart is about to go tachycardic and hypertensive.
What's his heart rate? 235. Fantastic.
We actually have a list of medications in the hospital that are called sound-alike medications that have warnings at every nurse's station, doctor station to warn us of these things. This is what it looks like.
Ashley, on this diagram of the nerves...
Oh, I hate this. I hate this. This is gonna make me feel bad about myself. I don't even want to participate.
In the rear of your leg, what nerve just above the foot is missing?
Oh no, don't ask me about the peroneal nerve.
Correct, Shivani. In this picture, what are the names of the 3 nerves found just after the dorsal scapular nerve?
The long thoracic nerve?
The phrenic nerve, supraclavicular nerve, and axillary nerve.
Correct.
Jesus. She studied that right before. That's not fair. Oh my God, this is my biggest fear. Oh my God, what happens if they fall? Do they have a rope? Please tell me they have a rope. First of all, who goes in a hot air balloon? Aren't they like blimps and have issues all the time? Oh my God, how are they breathing? It feels like it's so high up. I would never do that. You can't pay me to do it. Back to the TikToks in just a second, but first I want to tell you about True Classic, a clothing brand that actually fits me. It's so hard shopping for clothes online because so often things just don't fit right. And as a full-time doctor, YouTuber, and dog dad, I just don't have time to go to the mall and try things on myself. Fortunately, I found True Classic, and now my closet is full of shirts that actually fit me. They're a little tighter around the arms and chest, you know, to show off those gains, and a little looser around my midsection to make them super comfortable to wear, especially for long hours. I wear these shirts all over the place, whether I'm traveling, out to dinner, or just working at home. They fit every occasion. And it's not just t-shirts either. They sell long sleeves, Henleys, button-ups, joggers, a ton of great gifts for the guys in your life. Upgrade your closet and shop now to unlock huge savings during their holiday sale of ultra comfortable, perfect fitting essentials. Just go to trueclassic.com/Dr. Mike to save now. Let them know I sent you. All right, let's get back to the TikToks. Oh! Right on the lumbars.
Oh my God.
I didn't think he fell that hard on his pelvis to break his sacrum or coccyx, but if he broke his tailbone, oh man, that's a donut pillow for at least 4 to 8 weeks. Wait, oh wow, hold on a second. So he's balancing himself on a wine bottle / champagne bottle / rosé bottle while using the other arm pushing coins. And this is important solely because of views. And he's doing a push-up. That's sick. This is the strongest person ever. I shouldn't have said anything negative. I'm gonna get beat up. I apologize. You did great, sir.
Oh, I'm going fairly dark from down the lane. You won't believe the things I've seen. It's insane.
This is a pretty interesting song.
Folks are munching lunch we and it's a disgrace. Moldy cheese in the sandwich and a stomach ache. Don't eat that lunchly, it's a health attack.
What's a health attack? This is worse than what happened with the thumbnails.
Your mind's in a fog, you're all distraught. Hallucinations, fever, sweats.
Is that the next version of Lunchly that contains mushrooms, but not the edible kind?
Stop it. Get some help.
What happens if you drink lemon water for 14 days?
The same thing that would happen if you just drank water without the lemon for 14 days. Mind blown.
Lemons have over 30 different phytonutrients. If you have the chance of using an actual lemon squeezed in water, that's better because it's not pasteurized. The acidity in lemon helps you absorb minerals.
Before, it was alkaline water. Now it's acidic water. These health channels need to figure out which direction they're going in.
Lemons are loaded with vitamin C, which is really good for collagen. This supports your skin and tendons and ligaments and joints. Lemons also help you make more bile to prevent gallstones.
Yeah, but here's the thing. Consuming those nutrients is important, but consuming them for 14 days when you've been consuming those nutrients perhaps in another food doesn't change anything.
Just squeeze a whole lemon in a glass of water and drink away.
See, if he didn't give those instructions at the end, I would just look at the lemon and look at the water and say, how do I get it in there?
Well, when life gives you lemons. There's one reason that you can skip leg day.
Let me see if I can guess it. The one reason you could skip leg day is if you just did leg day already?
And it's if you were fat for 25 years. I was fat for 25 years, so I've already done thousands of leg days.
Is that how it works?
I would get up, I'd walk to the refrigerator, leg day.
I don't think that's how it works. In fact, focusing on leg day when trying to lose weight is gonna be metabolically healthy and give you an advantage. Because as you build up muscle in an area where there's lots of muscle, like your quads, your glutes, your hamstrings, you're gonna build up a lot of muscle. And that muscle will require calories to sustain, which you will then be burning off as opposed to burning less of.
I would get up out of bed, leg day. I'm good for leg day for like
I hope this is a
25
joke.
more years.
See, sometimes context is important, but I'm hoping it's a joke. Because on this gentleman's shirt, it says bookstore, so I'm thinking it's a joke. Because usually those who read a lot of books, I like to think of as usually smarter. The only person who disagrees with me on that is Jake Paul, who recently called me a book-thumping sheep doctor, because I guess Jake Paul doesn't like doctors who read books. Best of luck.
I was reading this study about surgeons where they found that surgeons who regularly play video games make less errors.
Yeah, this isn't a huge study, and they actually played a surgical game in this scenario. But this also seems pretty self-explanatory. A professional basketball player will be better than me in crumpling a paper and throwing it into the waste bin. That's how I would say it.
24% faster and scored 26% better overall than their non-player colleagues.
Oh, I believe that for sure.
Incredible.
Well, then
like that, you should be required in medical school to play video games.
Yeah, I mean, you're required when you're practicing using these devices. That's what you're doing. I mean, you don't necessarily have to play video games. You could just use the training simulator, which functions like a video game. It just happens that there's overlap with video games. So if you enjoy video games, you get the added benefit.
Here's what I eat as a high-fat, 5-year carnivore. Thanks to this lifestyle, I've lost 30 pounds of fat, reversed my cystic acne, psoriasis, and eczema, and I no longer fart, have brain fog, or any PMS symptoms.
Call me off guard.
I've got some oven-baked chicken wings that I baked at 380 for 45 minutes. I've got my usual cold stick of butter straight out of the fridge, unsalted. Here I have two 80-20 burger patties. I just fried it in its own beef fat. And last but not least, I've got my golden jello, the best food for skin, hair, nails, and anti-aging.
How am I gonna do this? I can't say anything about what this is doing to this individual's body, because if it's working for them, I'm happy and that's good. I'm not one to comment. But for you, don't ever do this. I can't even think of a specific situation where I would recommend it. There is so much risk from the overconsumption of saturated fat, the lack of fiber, the lack of certain vitamins and minerals, the lack of diversity of foods. But again, generally speaking, not telling you what to do, because I'm not your doctor.
What do you think about no longer farting?
Yeah, I mean, is her digestive system working? You know, post gastrointestinal surgery, one of the things we wait for in order to understand that the GI system is restarted is waiting for the patient to fart. So if we're not farting, is the GI system working?
That's a good question. I don't know.
Okay, we're doing, wait, hold on a second. Is he seriously just training one side of his body, or is this a medical condition?
My arm's actually paralyzed. Basically, that actually happened because I was riding a snowmobile and I crashed into a tree.
And it must have torn the brachial plexus.
Head flung one way, nerves tore out. There you go, man. That's how you paralyze your arm. This is actually a picture. I did my first bodybuilding show like a little over 2 weeks ago. It really helped me gain more confidence in myself, and I kind of surprised myself in what I'm capable of doing.
That's awesome. And you're also improving your health metabolically because you're putting on the muscle.
So, you know, always strive for more, never give up.
Facts on facts on facts. Finally, a TikTok I can get behind.
I'm at the ER because I was half asleep and I needed to put my antibiotic eye drops in tonight. And instead of grabbing the eye drops, I grabbed the Kiss nail glue.
She put nail glue in her eye?
This is them rinsing my eye out. They already took out 3 shards of super glue.
That's incredible, because I don't know how that super glue reacts with the tears. Chemicals all have these really unique interactions, and anytime you get something in your eyes, going to one of these eye wash stations is the most important thing, rinsing out. Not necessarily rubbing, because rubbing can create more damage. There's some acids like sulfuric acid. If it gets into your eyes, not only does it cause a chemical burn, but the chemical itself reacts with the water and creates a thermal burn as well. So you're getting like double the burn on your eye. Ugh.
Doctors did say that because she rushed to the bathroom to attempt to wash the glue out, the overall damage was minimal.
See, eye wash right away, first step, most important. Hi, I'm Sophie. I was born with a life-threatening lung disease called cystic fibrosis. I was told I wouldn't live beyond 16 years old, and at 19 years old, I was given 2 years to live. I am now 32 and have dedicated my life to my passion of defying the odds via pushing my physical and mental boundaries, doing all the things I got told I'd never achieve. I'm going for the world record of the most consecutive marathons run by someone with cystic fibrosis. I hope to inspire one person to have the courage to chase their goals. Oh my God. This must be a treatment for cystic fibrosis, because cystic fibrosis is a genetic condition that creates excess mucus, and that mucus can make it very difficult to breathe, for your GI system to function. What's interesting about cystic fibrosis is that the life expectancy in the last 20 years has nearly doubled.
34-year-old Nikki loves to eat cornstarch all day long.
Cornstarch is really nutritionally empty. Calories from carbohydrates, that's it.
Cornstarch is normally used for thickening, baking, but me personally, when I buy it, it's strictly for eating it.
Interesting.
My first craving for the cornstarch started when I was pregnant 16 years ago. Most women, when they're pregnant, they normally crave like pickles and ice cream, things like that, but my craving was cornstarch.
There's a condition called pica that basically creates cravings of eating all sorts of things. I've seen patients eat mud, dirt, sand.
My son, Marquise, he was 4 years old. He passed away 4 years ago due to a seizure. Since Marquise has been gone, I did start eating cornstarch more than I normally was.
There's some kind of psychological coping mechanism going on here. People find pleasure and safety in all sorts of aspects of life. Sometimes it could be a safety food that reminds someone of how they felt during a safe moment in their lives.
Oh, hi there.
What you got there? Whoa!
There was absolutely no need to catch her like that. That's so ridiculous and so obviously staged and getting me so obviously angry.
It's like smoke everywhere.
Oh,
I'm a psychotherapist specializing in disordered eating and addictive behaviors.
I'm JJ Virgin. I'm a certified nutrition specialist and a certified health and fitness specialist. How often are you having bowel movements?
Maybe once a week.
yeah, that could be as a result of not hydrating enough or perhaps having low fiber. Again, you can't jump to that conclusion without doing a full evaluation of the patient. And I'm sure the show will do just that.
JJ and I pulled the cover off this pool to reveal the amount of cornstarch mixed with water that Nikki eats in a year. This is 1.5 feet deep.
These visuals piss me so much off. I just refuse to believe that there's evidence saying that if you show someone how much they eat in a year, it has any impact on their behavior.
What do you think's gonna happen if I walk on this?
Sink.
Are you asking that genuinely?
Wow.
If you walk fast, you can walk right across it.
And I don't understand how this is valuable to her journey at all, but I completely understand why the producers thought it was valuable for their show. So you know who this show is out to help.
Are you ready to see and experience what 6 months of your
Oh my God.
looks and feels like?
Are these people legitimate medical professionals that they're doing these things to these patients? Like, this is so ridiculous.
What?
Whoa.
It looked like a volcano had erupted.
Whoa, so cool. It's like a scene straight out of Breaking Bad.
You're goddamn right. What Nikki was really needing was support and somewhere to go with her sadness. I don't want her to go to cornstarch. I want her to go to her husband. If we take away cornstarch, we gotta add something. And what we need to add
is you running on cornstarch and losing your shoes and then going into an attic and spraying it everywhere.
Is the strength of this marriage is you being able to go to your husband.
When you're hurting, I'm hurting too as well. You have to let me know. You have to be open to me as well.
I'm obviously joking. This is good communication between partners.
I recognize that Nikki's going to have a craving for cornstarch for a while, and I think tapering is going to serve her better. We made a healthy rendition of her cornstarch by adding protein powder and fiber powder into it.
At least you're getting some better macros in there with the protein powder.
By day 3, Nikki's urges to eat cornstarch are growing stronger.
But when I do have the urge for cornstarch, I just go to my mixture with the protein and fiber.
This is where the therapy would be very supportive, instead of just throwing it on the husband and saying, you solve it every time she's having these emotions. Like, I hate these fake therapy things on TV because it's so disingenuous of how it actually happens. In a situation like this, she would meet with a medical professional who's gonna try and explore why she's having these cravings. What is she thinking about during these cravings? What triggers the cravings to come on? And find actual ways to deal with those situations instead of sitting and making her run across cornstarch with water and then having her sit with her husband and have a great scene for television. Actually help her with mental health counseling. Show what it's like.
Kate's a devoted mum who loves to spend time with her family, But behind closed kitchen doors, life is no walk in the park. Because Kate's diet is almost exclusively cheese.
Not gonna lie, that is my dream. I'm like a little mouse when it comes to looking for cheese.
Because I have that memory of eating it from being a little girl, it's so safe. So I know that I can tolerate it and eat it and it won't make me sick or it won't make me feel uncomfortable.
Well, the thing with cheese is it absolutely can make you sick, even if you don't have a lactose issue. There's all sorts of bacteria that can build up in cheese. Listeria is a common one. And there's been a lot of conflicting data coming out on cheese on whether or not it helps decrease cardiovascular risk or increase cardiovascular risk. Are you getting good benefits from the micronutrients plus probiotics, or are you getting more harm from the saturated fat and overconsumption of calories? It really probably is going to depend person to person.
Sadly for husband Jeff, Kate's fear of anything hot and saucy means his home-cooked specialities are her worst nightmare.
Oh, I wonder why.
If Jeff's cooking something, he'll say when it's done, are you going to taste it? And then as it gets nearer, I can feel myself getting really, really anxious.
I wonder if this is some kind of phobia that you can perform maybe guided desensitization on to help decrease these physiologic responses that she's having of nausea.
I'd like you to go and grab one of those suitcases for me, please. Okay.
Where's she going?
And then unzip it and then tip out the contents.
Oh, cheese.
That represents how much cheese I eat. In what sort of time frame? A year. 6 suitcases worth of cheese is how much you're eating in a year.
What is one supposed to do with that information?
Pixie wants to show her the internal effects of her stodgy diet. She's got 10 meters of tubing, half what's inside the average person. She's prepared 2 liquids. One represents fibre-rich food and the other, Kate's cheesy diet.
Well, that's another good thing to point out, that cheese is usually not rich in fiber. We know fiber to generally be considered a healthy nutrient that you want to make sure that it's present in your diet in order to decrease potentially some risks of disease and slow the absorption of foods and to make you more regular.
I want to get you to transport the fiber-rich food right through the intestine for me. Now, what do you notice about that?
It's running down quite quickly, no problem at all.
Can I get you to do the same thing with the cheesy stuff? Oh.
This is so not accurate of what happens inside of our stomach. It's not just a bland pipe. Our GI system actually exhibits a neuromuscular function called peristalsis, where it literally, through waveform motions of the gut, pushes food along the track. So it is more absorbed and it does move freely. This is obviously just like a silly example.
Head chef Steve Hildebrand has been lined up by Natalie to demonstrate to Kate that the pasta she's terrified of is actually made up of ingredients she's already conquered.
This is this desensitization that I was talking about. This is one way of accomplishing a decreased physiological response to the food.
I'd suspect that that's the largest combination of flavors and ingredients you've ever tasted in one go. Yeah, ever. Yeah.
I mean, exploring your palate is generally a positive thing to do, because when it comes to eating in moderation, that's usually a healthy strategy.
The floating city of Venice is home to some of Italy's finest restaurants.
Can I have the spaghetti with meat sauce?
Wow.
Thank you.
And I'm not gonna judge the food choices she's making, because that's not my place. The point I wanna make here is that she's incorporating new foods that have different sources of protein, that have different micronutrients, perhaps some more fiber. Therefore, she's gonna get a more well-balanced meal and have a lower risk of developing a nutritional deficiency. Back to the show in just a second, but first I want to tell you about True Classic, a clothing brand that actually fits me. Online shopping for clothes is difficult because most stuff just doesn't fit right. And as a full-time doctor, YouTuber, and dog dad, I just don't have time to go to the mall and shop around. Fortunately, I found True Classic, and now my closet is full of shirts that actually fit my physique. They're a little tighter around the arms and chest to show off those gains, and a little looser around my midsection to make them super comfortable. I literally wear these shirts everywhere, whether I'm out to dinner with friends, at the gym, or even on stage during my presentations. It's not just t-shirts either. They sell long sleeve Henleys, jeans, button-ups, joggers, a ton of great gifts for the guys in your life. Upgrade your closet and shop now to unlock big savings during their huge holiday sale of ultra comfortable, perfect fitting essentials. Just go to trueclassic.com/Dr. Mike to save. Let them know I sent you. All right, let's get back to the show.
26-year-old Daniel drenches all his food in maple syrup.
I got my syrup going.
I put maple syrup on everything that I eat. Breakfast, lunch, and dinner.
It's gonna be a surefire way to increase the sugar content of anything he's eating, which if he's even remotely over-consuming calories in his meals and then adding that on top of it, you're gonna get into a place where you're gonna be putting on weight, and that's the unhealthy type of weight, where the odds are that you're gonna be putting on visceral fat, which is the fat that surrounds your organs and is considered less healthy.
Each and every day, Daniel downs more than 2 cups of maple syrup.
Wow, that's a lot.
That amounts to nearly 2,000 calories a day.
That's how much an average adult should be really consuming, period. And he's just doing that with the maple syrup. And it doesn't look like he's using a high quality maple syrup, which to me doesn't really reflect the true nature of maple syrup, where if you truly tap a tree and get the maple syrup out of it, you're gonna get some nutrients, but in these hyper processed ones, a lot of times what you're gonna get is just processed junk, refined carbohydrates that spike your blood sugar, spike your insulin, create all sorts of unintended unhealthy effects.
His eating habits are catching up to him. He's not as active as he was. He's not as energetic as he was. The maple syrup is taking its toll on his body.
Yeah, when you're gonna overconsume the maple syrup, what's gonna happen is your body's gonna store the excess sugar as triglycerides. It's gonna deposit itself in your liver. You're gonna have insulin spikes. You're gonna see hormonal changes. And most importantly, you're gonna see body fat increases. And when you start carrying excess body fat, your risk of heart attack, stroke, cancers go up. It really is a detrimental effect on the human body.
This maple syrup here, how long does this last you?
About 4 to 5 days.
Sounds like it's your drug. Sounds like it's...
I won't go that far, sir. I don't even know you, and you shouldn't even talk to me like that, you know?
Yeah, I agree. Even though it's unhealthy, the way this person's talking to them is a little aggressive. Part of having a good physician-patient alliance is being on the same page. And you did not start that conversation off on the same page.
Oh, my Lord.
We used a storage container to stash 912 pounds of sugar, 2 years worth of what he's eating. Yeah,
So-
2,000 calories a day of sugar that you're downing.
Who talks like that to a patient? The food that you're downing. Who are you?
It's a lot of syrup.
We've set up 2 years worth of Daniel's maple syrup.
No, what you should be saying is we wasted 2 years worth of maple syrup to set up a stunt for this camera.
We actually want you to pour every single one into that trash.
In the era of wasting food, this is so terrible.
I don't know why you guys are wasting this much syrup. That's crazy.
It's trash.
No, it's not. It can totally be used as a sweetener appropriately. Overconsumption of it is unhealthy, but the judgment that's coming from these supposed two mental health professionals and nutritional specialists is really upsetting. I would have loved to see the mental health specialist, this Dr. Mike character, step in and say something about this and call it out that this isn't healthy.
The real shocker came when I looked at his body composition. You have 42 pounds of fat on you.
She says it so judgmentally, it's insane. 42 pounds of fat, like what does that mean? Give me a body fat percentage. That's the real value of what I wanna know. And that's a body impedance scan. They're not super valuable. It's slightly better than, let's say, just doing a BMI for the average person.
You should be sitting there, honestly, 8-9% body fat.
Excuse me? 8-9% body fat? What is he, a bodybuilder?
I gave Daniel this information and I think he heard it, but I wanted him to really feel just how out of shape he really was.
I'm gonna make you feel terrible about yourself, and that's gonna help you get better.
Come on, up. Let's go.
When JJ made me do sit-ups, I knew that I have a problem.
They're forcing him to say that.
Daniel didn't even make it a minute. He was sweating, he was struggling.
That's what exercise is, since you've clearly never taught anyone exercise.
That is peach salsa.
That is good.
Now Daniel has some alternatives that have 1/8 of the sugar of his maple syrup that he can use to push maple syrup out of the way.
Well, that's a good alternative. I'm okay with that. That's making progress in the right direction. At least it's a little bit of a practical step that he can use, as opposed to, hey, you suck at exercise.
We wanted to show him somebody who was young, who had kidney failure, and now he spends 3 days a week, 4 hours at a time at this dialysis clinic.
Mikey, how old are you?
I'm 36.
Why does Mikey have kidney failure?
We wanted Daniel to understand that by the time he started to feel bad, it could be too late for him.
Are they saying he's gonna develop type 2 diabetes and then not control it with medications and then develop kidney failure? It's so much to the point where he ends up being on dialysis? I mean, this is so strange.
Dan, you look a little freaked out.
I don't want to see this.
The sooner you can make a change, the better.
This is so awkward and wrong.
I could be in this situation a couple years from now. I don't even know how I would adjust to this.
Why are they shitting on this poor guy's life? We don't even know why he has kidney failure.
Dan, when we met you, you were eating a gallon of maple syrup a week. How much are you eating now?
Quarter at least of a gallon.
Daniel has cut down his maple syrup consumption by 75%.
That's moving in the right direction for sure. They're such assholes though.
36-year-old Misty drowns everything she eats in tartar sauce. Every meal, every day.
This show feels so exploitative?
Exploitative.
It's so bad that it's both.
In just tartar sauce alone, Misty consumes a mind-boggling 14,000 calories a week.
That's a lot of calories. That's 2,000 calories a day. People think that this is a physical issue, but it's actually a mental health condition that's driving her to feel this way about the tartar sauce.
Eating tartar sauce is almost like having an orgasm.
Wow. I've never heard anyone discuss tartar sauce in that way. Tartar sauce isn't even considered an aphrodisiac. Not that any of those aphrodisiac things, by the way, make any medical sense.
Tartar sauce in your purse, Misty? Really?
I don't know how they got there.
Open that truck.
They have to do the visual every episode.
Oh, there's another one. Wow.
Oh, I thought they were gonna fill up the truck with tartar sauce.
For real?
Yep, for real.
People have legitimate medical issues, and this is how they treat it.
We're gonna send a year's worth of tartar sauce rushing towards you right now. Are you ready? Here it comes.
This is so sick.
Just to see all that ooze and goo sliding down the slide, it even grossed me out.
It's all the fat in that tartar sauce.
This is, ooh, no.
If there was a shortcut to creating an eating disorder, it's this.
What do you see?
Heavy-set woman.
You're obese and most likely at this point morbidly obese.
The fact that you say that with a scowl makes you a scumbag.
This could be as bad as it gets, but if you keep going. We had created a picture of Misty with about 50 more pounds on her.
Did they Photoshop her to be bigger? Are you trying to create a body dysmorphia? If I was in this producer's room, I would tear these people apart.
Tartar sauce is 74% fat, while the Greek-style yogurt JJ is using is only 2% fat.
I want you just to taste it.
Okay. When I first tried the Greek yogurt, it was disgusting.
Greek yogurt unflavored is not for everybody, but it is a good substitution for tartar.
Just the base. We're gonna experiment with a bunch of different tastes and we're gonna find a couple things that you like.
Substitution is good. This is the one part of the show that I'm not angry about.
Misty is ready to share her new sauce choices with her daughter.
This is real good. This
is the one positive thing about this show.
Yogurt and the spicy brown mustard.
That's why like spices are really great in that they usually don't add calories. Some spices don't even have sodium content. Why is he fighting with the monkey? Leave the monkey alone. Did the egg land in poop? Because I'm sensing an E. coli infection incoming.
Dad, that's filthy.
Honey, 10-second rule.
My guy, it's the 5-second rule and even that's not accurate.
Ugh.
All right, primary digestion happens in the mouth. Mechanically, chewing, chemically, saliva. It has salivary amylase. Amylase. It breaks down the sugars in your mouth.
Uh-oh, looks like we got some germs on that egg. Baby, it's time.
I don't know if white blood cells are just hanging out in the mouth. I don't think that's quite right. They hang out within the blood. White blood cells live in the blood, hence the word blood cell.
You got plans for the weekend, kid?
Oh, yeah. Me and my girlfriend are going down to the kidneys to see the stones.
To see the stones. Oh my God, I would have liked the joke better if it was the gallbladder they were gonna see gallstones. They're more benign. That's the only reason I say that. I think kidney stones cause a lot more pain and problems, like blockages and stuff. Like gallbladder stones can be a problem, but a lot of times if they're small, they sometimes can pass on their own. It's not that big of a deal. Kidney stones, I've had one. Wow.
All units south of the stomach, be on the lookout for illegal organisms.
Moses Jones to dispatch. We got multiple germs. I repeat, multiple germs coming down the windpipe. And if these bad boys hit the bloodstream, we're gonna be chilling.
Oh, I'm assuming that's an artery and they're traveling in the bloodstream. Oh, he just shot something at it and missed. Oh, he hit the nerve. Oh! Bill Murray's gonna feel that.
Yeah! Oh! 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 No! Oh, it's a cramp.
That's not exactly how a cramp works, but that's fine. The important part is to show that your immune system, if it causes enough of a response, it actually causes more inflammation, more pain than it needs to, and therefore breaks down surrounding tissues.
Careful. I'm contagious.
Ooh.
Ow.
See, I can't tell if he's a bacteria and he's causing all this toxicity around him, or is he a virus infecting surrounding cells? I think probably a bacteria, because a virus would essentially recruit the other cells to become virus-like to create more of itself. And he's not really doing that. He's just in destruction mode.
I just needed some sodium.
No, not chicken wings.
That's what made me cramp up.
I love that she's massaging his bone. That's gotta feel uncomfortable.
Hands up. Chicken going down rough.
See, he's gotta stick his tongue out and then say ah to raise his airway or to lower the soft palate.
Definitely red.
Are you ordering out?
No, I'm making you an appointment to see the doctor.
Smart!
How do you think you get sick?
Germs.
It's the way you eat.
It's your genetics plus your lifestyle factors. And if we really look at it, it's about 50-50.
I feel a little fluey.
You know what they say, starve a cold, drown the flu.
Wrong!
There you go.
And now with beer.
Tricks and all.
Now arriving with some milk, a cold pill with a pleasant pretty flavor.
I love that there's a danger ulcer repair sign because he has acid reflux and they're trying to fix this poor guy's ulcer.
Special Agent Drixobenzomethamphetamine.
Okay, that's not a medical term, so don't worry about that.
Warning, do not exceed recommended dosage. If symptoms persist, consult a physician. May cause drowsiness. Do not attempt to operate heavy machinery. Pregnant women should not handle broken tablets.
It's so, so important that you do not take NyQuil, Tylenol PM, Advil PM, Benadryl during the day. You will get drowsy, you will get sleepy, and God forbid you operate heavy machinery or drive a car. Wow, it's a recipe for disaster. So be really careful with those medications.
Did the foot fungus pay up yet?
Nah, that guy's getting flaky on us.
Why is this dude chilling in the armpit when there's a tinea pedis hanging in the foot? Huh? Or is it an onychomycosis? Onychomycosis.
I'm looking for volunteers, yo. Some nasty germs who want in on a big score.
Look who thinks he's the Ebola virus.
Let me tell you something about Ebola, baby.
Ebola is a case of dandruff compared to me.
Well, not really. Ebola's quite dangerous, actually, and very lethal.
Hypothalamus controls the temperature for the entire body. We are gonna march right in there, and we are going to take the prize. And then my man Frank's gonna heat up like a sidewalk on a summer day.
It's not exactly how it works. The body has a set temperature point that does go up based on you having an infection. And if you have an infection, you want that set temperature point to go up because it gives your body the best chance to fight off this guy. So like what's happening here is almost counterintuitive. This dude is setting up Frank's body to fight him in the best way possible without even knowing. See, this makes absolutely no sense. Because in certain infections, like if you get malaria, you get a really high fever. But you get a really high fever so your body actually recovers. In fact, back in the day when we didn't have antibiotics, we used to infect people with malaria in order to give them a high fever, cure them of whatever they were infected with, and then treat the malaria with the treatments we had available like quinine. Fevers are good for you. Fever would actually be killing this bad pathogen. So the fact that he's hacking it to make the body hotter is like him self-destructing.
What's the story on this one?
I don't know. I don't know what it is. The guy's burning up.
Well, if he's burning up, that means he has an infection.
What's his temperature?
106.2.
Oh, 106.2 is extremely, extremely high. You need to lower that with antipyretic medications like this, whatever that pill is.
Losing him. Breathe.
Why is no one doing chest compressions? Like, just breathing into his mouth with the ambu bag doesn't actually help the situation. It sure maybe brings some oxygen to the lungs, but then you gotta circulate that oxygen with a beating heart. And if his heart's not beating, you gotta beat it for him by doing chest compressions. Okay, he's flatlining. Don't bring out the paddles. My guy, please do some chest compressions. Just do the chest compressions, chest compressions. You didn't even try.
That's it.
No, now that's it, epinephrine. There's stuff to do.
Okay, I'm calling it.
Maybe don't call it before you try chest compression. Worst doctor award goes to this guy.
Now let her go. Right, so you can ice me again?
No, so I can.
Virus con Dios.
Literally not how it works. Over-the-counter medications don't fight viruses or bacteria.
Wait a minute. He's got